just got back out of surgery. I didn't think I was going to make it, but thank goodness I am here. And I'm ready to teach you about the renal system. Now first we're going to start with glomerular nephritis. And that is exactly what it is. Glomerular, which is the filter. Neph, which is the kidneys. Ritis, which is inflammation. Now, acute glomerular nephritis can lead to chronic glomerular nephritis. We're going to talk about glomerular nephritis in a whole. Now, it is an inflammatory reaction in the glomerulus of the kidneys. That's the filtering part, right? Now, it's usually caused from a bacteria, maybe strep. And those antigens actually get lodged there in the glomerulus and activates complement. And once complement is activated, you know there's a lot of damage that can occur there in the glomerular, okay? The glomerulus. It causes scarring and decreased filtering. Now here's where our problem comes in. The decreased filtering due to the scarring from the complement, due to the antibodies, due to the infection. Okay? Now, like I told you, a main cause is strep, so please make sure that your patients understand they need to continue taking their complete dosage of antibiotics to completely get rid of the problem, okay? Don't stop when you just start feeling better. Now, the signs and symptoms would be a sore throat, and of course that is from the strep. But the malaise and headache is going to be experienced when the toxins begin to build up in the body, okay? Like the urea, and it's actually infused into the peritoneal cavity by gravity. It just drains in there, okay? Now, the fluid, which is probably around 2,000 to 2,500 milliliters, fills the peritoneal cavity, and that takes about 10 minutes. It's there for a while, like a prescribed amount of time. And this is called the dwell time, okay? It dwells in the peritoneal cavity. Then the bag is actually lowered, and by the gravity again, the fluid, along with all the toxins now, is drained into the bag. And this is, the whole process is what we call an exchange, okay? Now, the drainage, you should be able to hold it up and read a newspaper through it. It should be clear. If it is cloudy, that is signs for an infection, okay? Now, what type of person gets the peritoneal versus the hemodialysis? Well, someone who can't tolerate hemo can choose peritoneal. And peritoneal is good for diabetics with renal problems. Now, what if all the fluid doesn't come out? This is where you learned. Remember, you can move the patient from side to side to try to get all the fluid out. Okay? And it's going to take those toxins with the fluid. Now, the reason why this happens is because the fluid is very hypertonic, okay? And hypertonic with glucose. We'll get to that in a moment. Now, there's two types of peritoneal dialysis. There's CAPD, with a continuous ambulatory peritoneal dialysis, okay? And with the continuous ambulatory, the patient really has to have a lot of energy and desire to work with this and be active in their treatment, okay? They have to have the ability to learn and follow directions. This is not something that you want to be messing around with. It's a manual exchange, okay? You hang the bag, you let it fill, you drop the bag, you let it leak out. It's done 4 times a day, 7